Greetings to everyone who's joined us today. My name is Dr. Samarth Gowda. I'm working as a radiologist, senior resident in the Department of Radiology at Bangalore Medical College. Now, the whole perspective of making this small video was to shed some light to the general public and to all of my friends and families, members out there, to make you understand how radiology plays a pivotal role in the management of COVID-19 pneumonia. Now, along with that, I would also like to dispel certain wrong information about the perception of CT scans, when exactly it has to be done, how safe, or rather how efficacious it is to undergo a CT scan early on in the stages of the disease. Now, the first and foremost question that a lot of people have is how different is it from a chest X-ray? Now, if you think of chest X-ray as a two-dimensional image of the lung, a chest CT is a three-dimensional image of the lung, along with the fact that it's got wonderful resolution and can pick up the most minutest of the pathologies that can arise in your lungs. The next question is, can RT-PCR test be substituted for by a CT scan? Can it be used as a screening test? And the answer to this has always been known, is always been a big no. Now, this is simply for the fact that RT-PCRs is the gold standard when it comes to diagnosing COVID pneumonia, and CT scans have some amount of false negatives, especially if it's done early on in the course of the disease during the early stages of your symptoms. And it's during this stage where the RT-PCR is quite sensitive and can pick up cases at a higher rate. Now, if that's the case, another question that I get asked is, what are the chest CT finding percentages in patients of COVID-19 pneumonia if I'm going to do a CT scan early on in the course of the disease? Now, a lot of studies done across the globe have shown that if a CT scan is performed in the initial first, say, 3 days of the development of symptoms, there's a high percentage chance, approximately 70% chance, that the CT is going to turn out to be normal. Now, studies have also gone out to show that the peak findings, or the very definitive chance that you finding some amount of pathology in the lung by performing a CT scan, will be maximal at say approximately the 5th or the 7th day of you developing your symptoms. Now, what is the gist of whatever I just said right now is simply understanding the fact that if you are to get a CT scan, getting a CT scan done at the end of the first week of development of symptoms, probably on the 6th or the 7th day, is ideal, not as early as the 2nd or the 3rd day of you developing symptoms, simply because your chest will still be normal in most cases. Now, if that's the case, am I telling you to go get a CT scan simply because you're turning RT-PCR positive? Absolutely not. Now, just because you're RT-PCR positive doesn't mean you need to get a CT scan. So in that case, what are the indications for you to get a CT scan done in the first place? Now, let your treating physician decide this. You do not need to run to your nearest scanning center to get a CT scan. It's only recommended in patients who probably are elderly, who have a lot of comorbid risk factors, who have diabetes, who have hypertension, who have asthma, pre-existing cardiac conditions. If the patient's oxygen saturation is suddenly dropping below 94%, if they have worsening respiratory symptoms, more cough. Now, these are certain indications for which you probably need to go in for a CT scan. Now, how good is a CT scan in picking up the severity of the disease? Studies have shown that it's actually very, very sensitive and specific in the fact that certain studies have shown that the severity of lung involvement on a CT scan correlated excellently well with certain serum markers of inflammation, such as your C-reactive proteins, your procalcitonins. In addition, poor severity scores on a CT scan also correlated with patient mortality, morbidity, and even ICU admission rates. Now, we've set aside the fact that you do not need to do a CT scan in the early stages of the disease. We do understand CT scans can pick up how severe the lung infection is. But then again, a lot of questions that are coming across, that I've been coming across, is on the CT reports, there are two terminologies which people are getting confused with. One is CORADS and one is CT severity score. Now, CORADS is simply a suspicion score. Supposing I see the CT image of a patient, I'm going to compare that with a mental picture of how a typical COVID-19 CT image is going to look like. And I'm going to say that this patient's CT image has a high suspicion or a low suspicion of turning out to be a COVID-19 pneumonia picture. On the other hand, CT severity score is my way of conveying to the physician that yes, there are very typical findings of COVID-19 pneumonia, and I'm going to score this patient's CT scan based upon the percentage involvement of the patient's lung. Now, we know lungs are further divided into lobes and segments. Based upon the extent of involvement of each of these lobes or segments, we can score the patient's CT image. Now, there are two scoring systems. Few of them consider it for score of 40, few of us consider it for a score of 25. Now, in terms of CT severity scores, scores in excess of say 20 out of 40 and scores in excess of 18 out of 25 are the ones who are worsening in terms of clinical status, as well as these are the patients who have higher mortality morbidity rates as well as higher rates of ICU admission. Another interesting finding that we've been seeing of late is when we see scans of patients who've probably gotten the infection post their vaccination, who've had at least one dose of the vaccination, the finding that's very out there for us radiologists to see is the fact that the severity of involvement of the lungs is very, very minimal. This in comparison to people who are even younger, who have not even had even one dose of the vaccination. These are the patients who are coming in with very high CT severity scores, or rather very high extent of involvement of the lungs. Now, this is again very early days to come to a conclusion, but it's pretty evident to say that probably the vaccine is playing some amount of role in reducing the severity of the infection. So with that, I would like everyone who's watching this video anywhere to encourage people around you to get yourselves vaccinated, not only for your safety as well as for the safety of the people around you. Please stay home, stay safe, get vaccinated. And thank you, and hope this video was of some help to dispel certain misunderstandings, concepts, and to establish certain facts with regards to CT and radiology in the management of COVID-19 pneumonia. Thank you.